preventable. So that's the problem. We can fix that. About 4,000 infants die suddenly, no immediate obvious cause. In 2010, there were 2,063 babies who died of SIDS. 918 were of undetermined causes out of those 2,063. 629 were from accidental suffocation and strangulation in bed. So that just kind of goes over some of the problems that we have in our country. You can probably remember, or many of you can remember, back in the 80s or up until the 80s, babies were supposed to sleep on their stomach, and everything appeared to be fine. And you'll talk to many people who will say, well, I had 4 or 5 kids, and they all slept on their stomach, and they were fine. And that's the truth, they were, and that's good. But they were lucky, and you'll see how lucky they were in some of this stuff. But again, there's about 4,000 a year families who were not so lucky. So we're going to talk about SIDS and how we should not be saying the word SIDS out loud anymore. And then it would be SIDS versus accidental sleep-related deaths, and what is the difference? So first we'll talk about SUID. SUID is an umbrella heading, and it's sudden unexpected infant death. So that would include the accidental sleep-related death. We can reduce the risk versus prevention because we're not going to be able to prevent all of them. There's still 1/3 of those deaths that there just is not a cause that can be found for those infants who died in their sleep. So we have to know the difference between SIDS and a sleep-related death. Again, we don't want to use the term SIDS because sometimes it may take a whole year or maybe even a little longer to find out what exactly the cause was, or the high risk factors that they were able to find within an infant who died. And when they come back and tell them it was something that was preventable, the family just remembers that maybe we in the field had told them it was SIDS and there was nothing they could do to prevent it. So we just want to get away from that verbiage at all. So SIDS is still there. It's the sudden death of an infant younger than 1 year of age that remains unexplained after a thorough case investigation, which includes a complete autopsy, exam of the death scene, and review of the infant and family's clinical histories. So all of that stuff oftentimes takes a year or longer. We still don't have all of the numbers from 2016 for Michigan because some of that stuff is still being reviewed in many of these cases. So some of the current theories on SIDS is that there's a malfunctioning chemical receptors in the brain, the serotonin receptors, the sleep receptors, genetic factors, and then arousal defect, where they cannot get from the asleep phase to the awake phase without some sort of help. And that's just kind of the current theories that are going on right now. SIDS is not preventable, though. The risk can be reduced. It's not caused by vomiting or choking. It's not caused by any vaccinations. It's not contagious or the result of any abuse or neglect, and it's certainly not the cause of every unexpected infant death. When you go through some of the risk factors, what they found on these, the autopsies and the family history and the environment, they found some of the risk factors that are common. The high number of risk factors for mothers and the maternal risk factors would be smoking during and after pregnancy, the mom being less than 18 years old, poor or limited prenatal care, if the mom is anemic, drug or alcohol use, and that includes the father as well, poor baby spacing, so less than 18 months apart between babies, and history of UTIs or sexually transmitted diseases. Those are all the high risk factors for moms. And then for infant risk factors, low birth weight, less than 5 pounds, less than 37 weeks gestation. So the African American and Native American we'll get back to here in a second. Exposure to tobacco, smoke, and drugs. There's one thing, and we'll talk about this later too. One of the biggest things that people need to understand, we're never going to convince people to quit smoking. Anybody who knows or who does smoke knows that it's not good for them. What we say is not going to make them quit. but it would be important, or maybe a way that you could talk to the parent or the caregiver or a family member is, one, not to smoke around the baby or inside the home. And two is, if they do smoke outside, when they come back in, to wash up, because there has been signs of tobacco being absorbed through on babies who have died and on autopsy. So it's just important to get that message across. Like I said, we're probably not going to convince them to quit smoking. They already know it's not good, but maybe if we word it in a way that it's important just to make sure that you don't have the smoke on your skin or your clothing before you hold the baby. Males is another infant risk factor. For infants before they're born, the last thing to develop in utero is their lungs. And for males, it is literally the very last thing to develop. So that would be prematurity, and male is a high risk factor. Multiple gestation, that goes without saying. The other two, and I said we get back to, those are the Native American and African American. And with Native Americans, oftentimes they bed share. There's oftentimes a lot of alcohol use, tobacco use, and tight swaddling. And if you think about it for a minute, while swaddling is recommended at very young ages, the first month or two, until they are able to roll over. So think about it, if your arms are tied down to the side and you can't move your arms at all, and you roll over from your back to your stomach, there's just no chance. There's no way for these babies to roll back over when they can't use their arms. So that's an important thing about swaddling. For African Americans, we all really are a result of our own culture and how we were raised. For African Americans, whatever mom did, whatever grandma did, whatever sisters do, aunts do, you're going to do. And the prone position, the face down position, has been done for years, and that's just why they have found that they're the highest risk factor. And that's what they found when they've done the autopsy, is they were in the prone position. So it's important that babies are put to bed on their back, and we call it back to sleep to make it easy. So prone sleeping, like I said, is the environmental risk factor. It accounts for 40 to 80% of all of the SUID cases. Tummy sleepers have a 5 to 7 times greater risk of dying from SIDS or a SUID. And then back sleepers who are placed to nap on their tummy actually have a 19-fold risk of SIDS, which is pretty scary. Side sleepers have a 2-fold greater risk of SIDS. So it's important to remember that babies need to sleep on their backs. Also in the environment, overheating, babies that are overdressed, the environmental temp is too high, smoke and exposure to smoke, that kind of thing, those are all environmental risk factors. So just to summarize those, the belly sleeping, the soft sleep surfaces, overheating during their sleep, maternal smoke, bed sharing with an adult, children, or pets. That's another big one, is pets sleeping with babies. Those are all high risk factors, and just to keep that in mind. So sleep-related deaths are 100% preventable. The accidental suffocation and strangulation in bed falls under the SUID category, and the types would be suffocation, wedging, entrapment, and strangulation. So what we're going to start going over now is just reviewing some cases. There were people who came in, told their story, maybe did a recreation of how they woke up, in the hopes that other people will learn from their obvious death in their family. So one other thing that's important to know is that bumper pads, while bumper pads come in all shapes and sizes and in all forms and can match just about any wallpaper, the important thing to know is that the bumper pads themselves have suffocated a lot of babies over the years. They're not recommended. A lot of people are afraid to put babies to sleep in their cribs without those bumper pads because they think that the head can get stuck. And any cribs that are made would not be big enough between the slats for a soda can to fit through. So there really is no fear of that head getting stuck between there. So that's the important thing for people to know. No more bumper pads. If you ever used them and everything was fine, that's great. You were lucky. So bumper pads should be removed. They are a suffocation hazard, and they're actually banned from being sold in Chicago and the entire state of Maryland. So this little guy, Preston, in the bottom picture, he died at the age of 7 weeks old after he suffocated on a bumper pad in the bed. So some of the other things, the bed sharing, there are some places that you'll see maybe some different counseling sites that say it's important for bonding to co-sleep, but it's just so deadly. And again, like I said earlier, 4,000 families would give anything to have that night back. So just keep that in mind when people say that they're bonding with their babies. Bed sharing is not recommended by the American Academy of Pediatrics, and truly they are the experts. This gentleman, they didn't have any beds. They had no crib. They were sleeping on the floor on blow-up mattresses. When the father woke up in the morning, this was exactly how he woke up, completely on top of the baby. This one, the family had no bed and no crib. They slept on the floor on these air mattresses again. They were bed sharing. When they woke up in the morning, the baby was actually on the floor face down and had suffocated on the carpet. For this one, wouldn't that be horrible? Sometimes when you borrow a crib or you buy one maybe at a grocery store, a garage sale, or, maybe Goodwill or something, just ensure that everything is put together, that all the screw holes are filled, just those kind of things, because just one missing screw could lead to something horrible like this. So it's important for people to know and just to make sure that it doesn't happen. This family put 2 twin beds together. They pushed them together and then put the baby in between, obviously. This was how they had woken up in the morning. And then this, I don't know if you've seen these nap nannies. These things are not recommended. This baby was actually put to sleep on a nap nanny that was placed in the crib. Obviously, the baby got out, was stretching, and ended up smothering on that bumper pad at the head of the bed. So those nap nannies are not recommended. Again, what should be in the crib is nothing but the baby, a tight-fitted sheet and the baby, and that's it. So everything else is a hazard. This baby was bed sharing with an adult. When they woke up, they found him wedged between the headboard and the mattress. And then this one, obviously, between the wall and the head of the bed. In the late 80s and early 90s, they wanted to lower the death rate, and by theory, they thought maybe putting these infants on their side would be better. Because, if you think about it, if for babies laying on their stomach or their back, what if they start choking? And, if you put them on their side, maybe the saliva can roll right out, or the vomit. And it sounds good on paper, and they started using these wedges to keep the babies on their side. And initially, the infant death rate went down, but then shortly thereafter, it just skyrocketed, sky high. And the reason is they started smothering on these wedges in the blankets and the pillows that were kept in the cribs to keep the babies on their side. So they are dangerous. They've been deemed dangerous by the FDA, and they are off the market. So again, it's just on their back and nothing else. So when they did try to go to the back to sleep, the numbers went way down again. And the problem is that we've stayed at 4,000, and then with autopsies have shown that 2/3 of those then are preventable. So this, obviously, you can imagine the horror of somebody waking up and walking in their bassinet having malfunction like this. So this one, you can see what had happened, obviously, to this baby is they thought it would be more comfortable by putting a pillow in the bassinet. Obviously, the baby rolled over and suffocated on the side of the bassinet and the pillow there. So again, nothing in the crib at all. And then some other dangerous places to sleep. While that one on the top left looks darn comfortable to me, it is really not a safe environment for a baby. The other one is not recommended, is the car seat. And, you know, a lot of people think when babies, infants have respiratory infections, upper respiratory infections, that they really need to have their body elevated, and it's still not recommended by the AAP for them to sleep in their car seat. Same with swings, and obviously the picture on the lower right is just a little scary. So for this one, this looks like it would be a picture out of a magazine. Obviously, you can see the dangers of falling asleep on the couch with your baby like that. It's very dangerous. And then this poor gentleman was holding the baby in his recliner. He fell asleep. The baby fell down into the side of the recliner there and suffocated and died. When he woke up, obviously, is when he found that had happened. If you look at the one now on the left, maybe a week ago or maybe even yesterday, you would have just walked by some crib in some house that you were at and not thought a thing about it. But now you can see, obviously, you just want to cringe when you see all that stuff in that crib. And the picture on the right obviously looks very comfortable, at least it does to me, but is, again, another problem. So those are both dangers. And then I'm going to warn you that the next slide, after the twin slide, does have a photo of a real infant who died in their sleep. So I just want to warn you that. So if you want to look away when I switch slides, just want you to be aware. So twins, let's talk about twins. Would they be able to sleep together? You know, they've been in the womb together for all that time, and everything's been fine. But when they're out and they are sleeping in the same environment, they are smother hazards and strangle hazards to each other. And if you look at that crib on the left, it looks great, very pretty. But the problem is they have a blanket around them. They've got other toys in the crib, and it should be just one baby on their back, nothing else. And then obviously on the right, you can see the hazards with that in that bassinet. So again, I'm going to switch slides. And again, this is a photo of a real dead infant. So this baby was bed sharing with the parent. The mom woke up when she was lying on top of the baby. The baby obviously had rigor mortis. In the right hand, on autopsy, they found that some of the mother's hair was actually in the baby's hand. So this is obviously a issue. Sleeping with your kids it just can't happen, because there are no second chances. And again, we could have 4,000 people a year that would say, please give me that night back. And in Michigan, we have about 140 to 155 a year who die in their sleep. So what are the recommendations? The recommendations for safe sleep would be that the baby should sleep on the back for each and every sleep. They should sleep alone in their own separate sleep space in a crib, a bassinet, or a pack and play. No bed sharing with other adults or children, and a firm mattress with a tight-fitting crib sheet only. No toys, no pillows, no loose bedding, nothing. Including no bumper pads, no exposure to tobacco smoke. They recommend that a pacifier be used for each and every sleep. And the reason that they recommend that is that seems to help with that arousal defect, right? The sleep to awake phase. If you think about it, when a baby has a pacifier in their mouth and they fall asleep, that pacifier starts to fall out and they start that suckling motion, and that's a natural occurrence. So a pacifier is recommended by the AAP for every sleep. They do recommend room sharing with the caregiver, but no bed sharing. So bring the pack and play or the crib or the bassinet into the room of the caregivers, but not obviously in the same bed. And don't allow the baby to overheat. No more than one layer of clothing if it's winter like it is here now. No more than one extra layer of clothing than what the adult is wearing. And then educate all the caregivers about safe sleep, not just the parents, but everyone in the house. Avoid products that say they prevent SIDS. And I can't think of a time. I mean, I was in the field for a long time. I can't think of a time that I would encourage breastfeeding, but it is encouraged. They do recommend everyone to breastfeed, and I suppose mentioning that is not a bad thing. So what did these guys do? These guys in Fort Lauderdale. So what had happened is Lieutenant Carroll at the time, he's Captain Carroll now, was on the Child Death Review Board. I don't know if any of you have ever participated in that, but every single death of a child, anyone under 18, is reviewed to try to come up with what happened and prevention and those kind of things. So he was on this board. They had asked him to come to a summit. He didn't really want to go, and they offered him a free lunch, so he jumped on that offer. While he was there, he kept hearing the same things from the Healthy Mother, Healthy Babies, from the public health departments, from Cribs for Kids. People were saying, we have resources for people, but they won't tell us when they need something. They won't tell us when they need a crib. If they don't have a safe sleep environment, we can set one up for them, but they won't tell us that. And if you think about it, you can't leave the hospital with the baby without proving that you have a safe car seat and one that fits right and fits in your car right and is secure. But nobody's in the home making sure they have a safe sleep environment. And if you just had a baby and you're home and somebody with a state logo or a county logo on their car pulls in, you're probably not going to let him in. I probably wouldn't either. Because everybody thinks that you're going to have your kids taken away. What if I don't have a safe sleep environment? What if I couldn't afford it? Because all of this baby stuff is so expensive. Even at Goodwill or the Salvation Army, you have to pay for this stuff. So it's very expensive to have a child. So what they are saying is we have some resources, but they're not telling us maybe the truth when they don't have a safe sleep environment. So Jimmy started thinking and said, we're in their homes and we're trusted already. Maybe we can start doing inspections of these. Maybe we can start doing some fundraisers for some pack and plays. And if we recognize that there's an unsafe sleep environment, we can work on getting them that. And they don't have to worry about anything. So that's what they did. They started is the first fire rescue department in the country that proactively started to eliminate eliminate sleep-related deaths. So they called it DOSE, Direct On-Scene Education. So every single call that they go on, obviously there are going to be about 10 to 15% of the calls maybe that are emergent, that you wouldn't obviously have time to go through and do an inspection and maybe do some education. But most of the time you would be able to have a minute, or somebody on your team could talk to the family or inspect the crib. So if you see an infant or a soon-to-be infant or any type of that is in the home, if you can take a couple minutes just to go over safe sleep environment checks. We have what's called a safe sleep kit, which is just an envelope that has some pamphlets in it that goes over what should be in the crib and what should not be in the crib and how babies should be put on their bags to sleep, how nothing but, just the sleeper that they have or the knapsack that they're wearing is all that should be in the crib. They started doing that, and the first year that Fort Lauderdale started doing that, they dropped theirs infant sleep-related deaths by 2/3, which is literally what the science is showing. So they thought of this and said, truly we are the people that they trust. We are in their homes, and really it only takes a couple minutes. And honestly, if you think back to how many calls have you been on in the last year where there was an infant or somebody pregnant or, maybe even just babysitting or a daycare center. There really isn't that many. However, if we take these couple minutes, maybe, just maybe, we can prevent some of these unnecessary infant sleep-related deaths. So we started this. Jimmy came up here in August of 2014 and put us through a Train the Trainer program, which is about an hour and a half. So it's only about a half hour longer than what I'm going to talk right now tonight, and told us how to set it up. So I've been going around the state. Justin Allen, our EMS for Children coordinator, has been helping. And a couple guys in the Kent County area, Mel Oakley and Brian Stalsenberg, have really been pounding it out in their county, getting our departments on board with this direct on-scene education, where we see an infant or a soon-to-be infant, we can go over some education if we've got a couple minutes. Obviously, if it's a critical patient, we're going to take care of the patient and not worry about this stuff, but maybe set a policy where somebody will go back there within 24 hours to talk to the family to make sure that they have a safe place to sleep for their baby. To go through the crib, since they started doing this in Fort Lauderdale, they have found power tools, remote controls, toys, just tons of toys, hard to find babies, that kind of thing that they found in these cribs since they started doing this. So it's kind of crazy. So doing an environment check, where is the baby sleeping or where will they be sleeping when it's born? Is there a crib or a pack and play? You know what, as long as we can, as a state, provide pack and plays, we will make sure that your department has them. So that if you go on one of these and you recognize that there's not a safe sleep environment, you can set one up for them, and we will keep replacing these until we run out of them and don't have any money. But the hope is each year with our EMS for Children grant money, we can buy some pack and plays to keep a stock. So yesterday I got an email from Life Care in Battle Creek. They had been on a scene, on a call, and this woman had an infant, just adorable infant. They found that they had no crib, and she was embarrassed and said she just couldn't afford one right now. And she also said that her uncle, the baby's uncle, babysits, and he doesn't have one either. They're just struggling financially. So they were able to set up 2 pack and plays for them, one at their home for the baby and one at the uncle's house who babysits for them. And that's just something we want to make sure that our babies in Michigan are safe in their sleep. So I started to tell you, when he came in 2014, we started doing this on-scene education training. 2015 was pretty busy doing some of these educations. And, in 2015, the numbers of sleep-related infant deaths were broke a record for high numbers of infant sleep-related deaths. But in 2016, after people started going through this, after our first responding agencies, after our EMS agencies started going through this training, in 2016, we had record low numbers in sleep-related deaths. So you'll never be able to convince me that it is from anything other than what we're doing out in the field. And when I say we, I certainly don't mean me, because I haven't been in the field, but I have known people that I've been able to provide pack and plays for that couldn't afford them. My sister is a labor and delivery nurse, and she's been able to give a couple people pack and plays that she just knew that they didn't have one and things like that. So it's a good thing that we're doing, and we just need everybody on board. Wouldn't it be great as a state if we went from 150 a year down to 50? And when I say it's good, it's great for obviously the family and the babies, but it's good for our mental health too. Nobody wants to go on those calls. Those calls are horrible. So that's what we want to do. We want to look at their environment. Is there a crib? Does it have bumper pads or toys or other crap in it, loose blankets, pillows? Are they bed sharing? And when I say bed sharing, it isn't just children or adults. It's important that people understand that pets are a smother hazard as well. So, and what's considered a safe sleep hazard? Well, a smoking environment, a family that's bed sharing, a cluttered crib, and a baby sleeping prone. So with this, we'll go through some of these that they have done in Fort Lauderdale. They asked to see they saw some stuff around the house that led them to believe there was an infant there. So they asked to see where the infant slept. And you can see on the top left, oh my goodness, right? Maybe yesterday you wouldn't have thought anything about it, but today you're going, oh, the hazards. So the blanket, the bed, all the other stuff, sleeping prone. And then what they were able to do was set up a pack and play for him. This little guy helped him set that up. And everybody's happy and, oh my gosh, a safe sleep environment. So they put the crib or the pack and play in the same room as the caregiver, but not the same bed. This was a residence where when they were there, they found that there was no crib at all, no pack and play or anything. So they were able to set one up, and now the baby has a safe sleep environment. This one, you can see, all the stuff in the crib, which are hazards. So they put these two little guys to work, and they were able to get that all cleared out and make a safe sleep environment. So look at that one. So that you just kind of go, oh my goodness, people are having a kid sleep in that. So they have, like I said, found power tools, medicine bottles, TV remotes, plastic bags, pillows, laundry, comforters, shoes, all of those things in cribs that are actually storing babies too. So good Lord, we can do better. So keep your eyes open. You don't have to be on an OB or a pediatric call to notice a hazard. So anytime you see any evidence of a baby, just seize on that opportunity and educate. And if there's a hazard, if they don't have a safe sleep environment, please let's create one for them. So that's our goal. That's what we want to have happen. So keep your eyes open. Like I said, if the patient's critical, obviously you'll be taking care of them, but maybe set up a policy where within 24 hours somebody would go back and be able to do some education, inspect the environment, and set one up if they don't have one. So let's look at this picture, and you can see, in addition to the wet diaper, what is wrong with this is that there's a blanket in with the baby. They're doing everything else right, but putting the baby in to sleep with that blanket is a smother and a strangle hazard. And then this picture, it's again another magazine type picture, but sleeping with your baby is a smother hazard. And we probably, honestly, there's not many more comforting feelings in the world than having a sleeping baby on your chest. But gosh, if you fall asleep too, you just can't get that back, So let's see this picture. While again, this looks very comfortable to me, it's certainly not a safe place for your baby to sleep. So how do we know that this stuff is going to work? The only way that we know, like I said, in 2015 we had record high numbers. In 2016 we had record low numbers. I am assuming the belief that it's because we are out there as first responders in the field recognizing unsafe sleep environments and helping them get a safe sleep environment. But we can't prove that. So the only way we can prove that is showing that we are out there doing this education. So you'll notice on the new EPCR documentation, on the new MyMSIS 3 or MyMSIS 3, however you want to pronounce it, we'll have a message on there, was safe sleep education done? Just a simple click yes if it was, ignore it if it wasn't, or that it wasn't an infant call or any of that stuff. It's there for when you do it. The nice thing about that is at the end of the year, I can run those numbers and say, see, this is how many people we've done this. These are how low our infant sleep-related deaths are. It's us that are doing the good stuff out there. So we're the ones that are helping prevent these from happening. And that's good. It's good for us. It's good for the family. It's good for everyone, right? So let me take a minute and show you this training video.
Unequivocally, I think that pediatric calls are the most difficult calls we run. Number one being that we run those less than 5% of our career in the total number of calls we have. So you have something that we hardly ever run, but you have to be on the top of your training when it comes to that. My very first pediatric code that I ran, I was, emotionally distraught. I was new on the fire department. Luckily, I had a wonderful partner who had the experience and able to do that. I can remember writing the report and one of my battalion chiefs coming up to me and saw that I was down and saw that I was depressed because of the call and how it affected me. I believe that training is unequivocally the most important thing that we can fall back on. If we know and we train and we do it over and over again, it becomes a muscle memory and it becomes something that we do second nature without thinking. I think that every call is a pediatric call. And you may have a patient that's sitting on the sofa, but it doesn't mean you shouldn't be aware of your surroundings and being intuitive. And when you see a child or you run you may not even necessarily be there for a child, but if you see a newborn, a young child, that you should inquire about them and you should say, hey, what's the crib look like? Do you have a crib? I've been amazed at how many calls we've run where you've asked somebody, do you have a crib? And they say no. So it is something that you should be aware of and something that we're there to prevent. It's our job. If we can prevent one of those children from being killed by cluttered crib or being smothered by their parents, that's one less call that we have to run in that way.
Last year, there were too many infant sleep-related deaths in Broward County. All these deaths could have been prevented if parents and caregivers were better educated on what not to do when putting their infants to sleep. You can help prevent an infant's death just with a small change in your behavior. The first thing to keep in mind is that every call is an infant-related call. Whether your rescue company responds to a kitchen fire or a heart attack emergency, taking inventory of your surroundings will reveal evidence of the presence of an infant in that particular home. Learn to look for the small signs: a crib, baby formula, diapers, bottles, or even toys. Also, pregnant women are good targets to communicate information about infant safety. Another very important point to keep in mind is that grandparents, aunts, and other family members might not have baby items in plain sight, but this doesn't mean that infants don't occasionally sleep in their home. In these cases, it is harder to spot the signs of infant presence, so it is important to always keep looking for signs. Of course, your first priority is always to take care of the main reason you were called in the first place. After the patient is stabilized, a designated member of the crew should engage someone on the scene and ask if there is a baby present in the home. If a family member reveals an infant 1 year of age or younger, a safe baby sleep kit should be given to the family, along with verbal education. If time permits, ask to see where the baby sleeps to perform a sleep environment check. If you see a crib cluttered with blankets, bumpers, and other items, remove these items and explain to the family why you are doing so.
You can never put your baby down on their belly. And all the stuffed animals and blankets and pillows, this stuff suffocates kids, okay? So look, we're gonna have to take this.
Sometimes financial constraints don't allow a family to purchase a crib. In these cases, the mother sleeps with their infant. This is a perfect opportunity to explain the reasons why this is dangerous. This is also the perfect opportunity to have a crib delivered to the home, provide instructions on how to assemble it, and make sure that every family member knows the do's and don'ts when putting the infant to sleep. Education of the entire family is crucial in preventing infant sleep-related death. You are the first line of defense. Remember, every call is an infant-related call.
For information on obtaining a crib and other resources for a family in need, please contact Healthy Mothers, Healthy Babies Coalition of Broward County at 954.
Well, you don't want to call them. They won't help you here in Michigan, but we will help you. So, one thing you should always follow up if you do put a pack and play in, or if you do maybe some education, just follow up with them if you have time. That's always a good thing. Again, the patient's number one. So if you can set up a policy that if you weren't able to do the education, check the crib, make sure that there was a safe sleep environment. Maybe somebody from the department could go back there within 24 hours to make sure that that is done. Because it's important that we not only hand out pack and plays to those who need them, but to educate on why it's important. Why is it important for them to sleep on their back? Why is it important for them to sleep alone and with no other things in their crib, no blankets, no nothing? To me, I'm always cold, so thinking of sleeping without a blanket is a little cringeworthy to me. However, what they're doing now is taking the babies home. They're giving them sleep sacks in the hospital, where it's kind of like those old blanket sleepers, only without the feet. It's just sewn across the bottom. And that really is showing that that's enough. What they found with some of these babies on the environment check is that they were just overheated as well. Their temperatures were too high. So it's important to remember that or keep that in mind. And again, the blankets and things like that are they're smother hazards, and strangle hazards. So if you want your department to start this, there are training kits available through the DOSE program at NICU-RN and ICU-RN at att.net. That is Jennifer Combs' email. We were able, as a department, to purchase 7 training kits. So the training kit is a DVD with the PowerPoint, the videos, and some other paperwork, a pre-test, post-test. You'll get that at the end of this. And then the video that I just showed, and then the PowerPoint that is the training PowerPoint for this, and 10 books. So we have those, and you can sign them out from here. I'll send it to you when you do your training for your department. Another website to go to is thedoseprogram.com, www.doseprogram.com. And then for Train the Trainer, you just went through the training. So we're just about finished with this training. So if you want a Train the Trainer, what I can do is do a one-on-one with you, or maybe we can set up a conference call if you're far away. And just get a hold of me at goddet@michigan.gov, goddet@michigan.gov. And I can do a Train the Trainer that way and get you the stuff that you need. Again, we have pack and plays. We want them to be given to those people who just can't afford them or don't have a safe sleep environment. So we started out with 515, and I think Justin said yesterday that we're down to about 180 or so now. But I think that we're going to be able to order some more. So again, we want safe sleep environments for our babies in the state. we want to be the first state to say, we got this. You know, we're now at 50 a year, and those were unpreventable. Those were things caused from that unknown reason. But all of our other babies, they're good because they have safe sleep environments, and it's thanks to us for helping this kind of thing. So that's what we're doing out there. If you guys have any ideas, any other information, please get a hold of me and let me know. So I think with that, I can take questions. I'm not sure how this works. So are you there, Emma?
I am.
Okay.
Great job.
Thank you.
All right, everyone. We are going to go ahead. I'm going to let you guys unmute yourselves individually if you have any questions or comments for Terrie. Bridget, I think, had a question, Terrie. She messaged me earlier and was wondering if you could explain why pacifiers were a good idea for babies while they're sleeping. She just didn't hear it that clearly.
Okay. My understanding is it is a recommendation of the AAP, is that it helps them to go from the asleep to the awake phase. So when they fall asleep and the pacifier starts to fall out of their mouth, they have a natural instinct to start suckling, and that helps that arousal defect work. That's the only thing that I know. I know that that's what the American Academy of Pediatrics says, though, that every baby should have a pacifier with every sleep. And babies, when I'm talking babies in the safe sleep stuff, it's 0 to 1 year old.
Thank you for clarifying that, Terrie. Yeah. Is there anybody else on the line that has any questions?
I have another question.
Go ahead.
Hi, Terrie. Thanks so much for the program. I'm wondering, do departments accept donations of pack and plays, or do they prefer that they're brand new?
So, it's kind of hard to say, and I have heard some people say, I'll donate my old one that I don't use anymore, and that's great. One of the things that, if it's really used, I would probably, as a department, maybe use it for training versus giving out to someone. So what we've had in some of the training programs, one of the girls from the east side of the state, she went down to Florida for it was a SimMan training. And she was there, and on the last day you had to do these scenarios with SimMan, and she went in and she said, I just rocked it. I knew that I just nailed this scenario, She was so proud of herself, almost patting herself on the back a little bit. Hope she's not on here because that probably isn't the truth. But she went to leave and they said, well, you failed. She said, well, how could I have failed, I know I nailed this. And they said, no. They said, when you walked in the door, what did you see? She said, well, the patient lying in a bed. They said, well, what else did you see? She said, well, nothing. And they said, well, look over on the side. What is that over there? Well, it was a crib, and they had a baby in there, not a real one. And she said, so it's a crib. They said, well, did you inspect it? Did you make sure that baby was safe in there? She said, I had no idea, but what a brilliant idea to start doing. Maybe when we're doing training, set something up like that, and just not really to catch them, but to make sure people are thinking of that when they go into the homes.
Does that make sense, Bridget?
Yes, thank you.
Are there any comments or questions? All right. Well, thank you, everyone, for joining us again tonight. And I want to thank you, Terrie, as well. This is a great topic to start off the new year. And if anybody has any questions after the webinar, feel free to contact me or Terrie. And again, please fill out the evaluation quiz and attendance form in order to get your continuing education credit. And on those evaluations, please, please, please fill that section out at the very bottom where you can list any future webinar topics. I have webinar topics set through May, and normally I take the summer off, but it doesn't mean I can't change how I do things, but I'm always looking for suggestions. And again, please fill out the evaluation quiz and attendance form within 2 weeks or by January 24th. And please look for registration for the February webinar in the next week or two. I will be sending that out as well. And I think that's about it. And thank you again, Terrie, and I hope everybody has a great night.
Thank you, Emma. Thank you, everyone, for joining.
Thanks, Terrie.
Thank you. Thanks, Terrie and Emma.
Thanks,
Thanks, Wendy. And Kathy, I saw you got on a little bit late, but I got you on here.